Good morning, everyone. I am Shreyashi Thakur, Assistant Professor in IIMT College of Pharmacy. Today, I am going to present my presentation, and the topic of my presentation is dosage form. Then, come to my next slide, in which slide we will know about the definition and types of dosage form. Firstly, what is the definition of dosage form? Let's see, the manner in which the drug substance are presented in the market is known as the dosage form. The drug substances which are going to be presented in the market that can be either solid dosage form, liquid dosage form, semi-dose solid dosage form, or gaseous dosage form. Then come to my next point, need for convert drug to dosage form. Why we need to convert the drug to dosage form? Then first point is for accurate dose. Next one is for protection. Example like sugar coated tablet, sealed ampoules that are protect the doses form from the environmental factors. The next one is the protection from the gastric juice, masking the taste and odor to mark palatable. The next one is the placements of drugs in within the body tissue, sustained release medication, controlled release medication, then optimal drug action, insertion of drugs into our body cavities like rectal cavities, vaginal cavities, etc., and the use of desirable vehicle for insoluble drugs. That is the main points in which we need for convert the drugs to the dosage form. Then come to the my next slide. Why we need for dosage form from a same drugs. Then to minimize the discomfort and instant relief and improve the patient compliance. That's why we need for different doses from the same drugs, because nowadays every patient or every people wants to instant relief from the any types of disease. The next one is what is the desirable properties of dosage form should. There are the various desirable property of the dosage form should be first, which is convenient to handle and easy to store and easy to use. Second one is stable during the storage and use. The drug should be stable during the storage because there is a various chance of breakage, spoilers, etc. during the storage condition. The next one is withstand mechanical shock during the transport. Flexibility in the different drug strength, provide expected therapeutic effect, then extend drug release, onset, intensity, duration of action, predictable. Then the most important point is which is economical and elegant. Economical means the drugs which are available in a very affordable amount in market that can be purchased by the everyone. This is the desirable properties of dosage form, which should be. Then come to my next slide, classification. Classification of dosage form are generally based on the four class. First one is the physical state, second one is route of administration, third one is site of application, and the next one is uses. First, based on the physical state, the classification of dosage form are divided into generally four types. First, solid dosage form. Second, liquid dosage form. Third, semi-solid dosage form, and fourth one is gaseous dosage form. Then come to the solid dosage form. Solid dosage form are also divided into two parts. First, unisolid dosage form. Second, bulk dosage form. The example of unisolid dosage form is tablet and capsule, and the example of bulk dosage form is powder and dusting powder. Then come to the semi-solid dosage form. Cream, there are various types of cream, paste, gel, ointments are a best example of semi-solid dosage form. Then come to the liquid dosage form. Liquid dosage form are also divided into two parts. First one is the monophasic liquid dosage form. And next one is biphasic liquid dosage form. Monophasic liquid dosage form, the drugs which contain the single medicaments or excipients is known as the monophasic dosage form. And the biphasic dosage form, which include more than one substance, is known as the biphasic dosage form. The example of monophasic liquid dosage form is syrup solution, etc. And the example of biphasic liquid dosage form is emulsion and suspension. The next one is gaseous dosage form. Inhaler is the best example of gaseous dosage form, which is generally used by the asthmatic patient. Then come to my next slide. Monophasic liquid dosage form. Monophasic liquid dosage form are also divided into two parts. First one is liquid meant for internal administration and liquid meant for external administration. Internal administration means the liquid which are taken inside the our body is known as the internal administration, and external administration means the doses form which are applied to the external part of the body is known as the liquid mean for external administration. The example of internal administration liquid is syrup, elixir, mixtures, slinges, etc. And the liquid meant for external administration is also divided into three parts. First one is liquid applied to the skin. Second one is liquid used in the mouth. And third in the liquid instilled into the body cavities. For then example of the liquid applied to the skin is various types of lotions, ointments, cream, paints, collidants, etc. And the next one is liquid used in the mouth. Examples is gargles, various type of mouth washes, throat paint, etc. The next one is liquid instilled into the body cavities. The examples are ear drop, eye drop, nasal drop, dodges, enemies, etc. Then come to my next slide. Dosage form are divided into classified into based on the route of administration. There are various type of route of administration. First one is oral, parenteral, rectal, urethral, sublingual, intraocular, transdermal, vaginal, etc. etc. Then firstly come to the oral route of administration. The various types of examples are given there. First one is tablet, capsule, powder, solution, suspension, emulsion, syrup, gel, peels, etc. as the best examples of oral route of administration. Then second was is parenteral route of administration. There are various types of solution and suspension, emulsion, etc. are used for the parenteral route of administration. Then come to the rectal route of administration. There are various types of suppository, enemies, ointments are used for the rectal route of administration. Then come to the transdermal route of administration as ointment, cream, powder, paste, lotions, plasters are the best example of transdermal route of administration. Then come to the vaginal route of administration. There are various types of suppository, ointment, creams, doses are the vaginal route of administration. Then come to the intraocular route of administration. Firstly, intraocular route of administration means the drug which are used for our eye is known as the intraocular route of administration, by which intraocular, the example of intraocular route of administration is various type of solution, various type of ointments, solution which are used to our eyes for the treatment of eye related disease or eye related infection. Then come to our next slide. Our site of application, site of application by through which we can use the dose which can use 80 types of medicine. First, site of application first include the skin. Skin is also a site of application. The example of skin is various types of cream, lotion, liniments are used to the our skin for the treatment of any types of disease. The next one is eyes. There are various types of solution, ointment, and creams which are applies to our eyes for treat the various type of disease. Then next one is tooth. There are various type of tooth powder, toothpaste are the examples of tooth. Then next one is hand. There are various types of hand creams, lotions, hand washing are available, which is applied to our hand. The next one is food. There are various type of food creams like crack cream, ointment, dusting powder, which is applied to our food. The next one is hair. There are various type of hair cream, hair shampoo, hair lotion, hair spray is the that are applied to our hair. The next one is nasal. There are various type of solutions, spray, inhalation, which are applied through our nose for the treatment of disease. Use and the next one is uses. Uses are also yeah, either internal use or either external use. Internal use means all preparation except then external, and external uses means there are various types of ointment, lotion, creams, powders, solutions, paste, hair dry, hair color that are applied to the external body parts is known as the external use which are used to the site of application. Then come to our next slide. Definition of solid dosage form. There are various types of definition of a solid dosage form. First, we have powders. What is powders? Powder are a solid dosage form which containing finely divided particles into a micron size. The next one is tablet. Tablet are also a solid dosage form which containing medicament with or without excipient. There are various types of tablets available in market. As for example, sugar coated tablet, film coated tablet, etc. Then next one is granules. What is granules? Granules are a aggregate of particles is known as the granules. The next one is capsule. What is capsule? Capsule is an enclosed drug which is covered with a gelatin. Then capsule are also two types. First one is soft gelatin capsule and second one is hard gelatin capsule. The next one is catches. What is catches? Catches are also a drug enclosed with water surface of rice is known as the catches. The next one is peels. Peels are a small tablet which contain a excipients. Next one is lozenges. As lozenges are also a solid preparation which contains sugar and gum, which is used to medicate our mouth or throat. The next one is suppository. What is suppository? Suppository is also a solid dosage form which containing medicament with or without excipients or suitable suppository base that inserted into our body cavities other than mouth like rectum, nose, ear, vagina, etc. Then next one is what is poultices. Poultices are also a solid dosage form which convert to paste-like preparation and used externally into the skin to reduce the inflammation. Then come to my next slide, definitions of liquid dosage form. There are also various examples of liquid dosage form. First one is what is collidants. Collidants are also liquid preparation for external use having nitrocellulose and used to protect our skin. Then next one is what is it? Draughts. Draughts are also liquid preparation for oral containing medicaments which are available in single or multiple dose. The next one is elixir. Elixir are also liquid preparation of oral containing medicaments with suitable excipients. The next one is what is emulsion. Emulsion is a biphasic dosage form. Biphasic dosage form means the dosage form which contain more than one excipients or medicaments is known as the biphasic dosage form. Though then biphasic dosage form for oral containing medicaments in which fine globules disperse in a continuous phase. The next one is suspension. Suspension is also a biphasic liquid dosage form which contain the oral medicaments in which fine solid particles suspended in the continuous phase. Then next one is enemies. What is enemies? Enemies are also liquid preparation for only rectal containing medicaments. Then my next slide is what is gargles. Gargles are also concentrated aqua solution which are used to treat the throat infection. Gargles is a very common things which are generally used by the every patients to case of any type of throat infection. The next one is gel. What is gel? Gel is also a aqueous chloride suspension which containing medicaments which is used as a antacid. The next one is what are linches. Linches is also viscous sticky substance, liquid oral preparation which is used to relieve from cough. There are also various type of linches are available in market. The next one is lotion. What is lotion? Lotion are also liquid preparation for external application. Usually applied without any friction is known as the lotion. The next one is liniment. What is liniment? Liniment are also liquid preparation which is applied for external application and applied with the friction. The next one is mixture. What is mixture? Mixture are also oral preparation which containing one or more than one medicaments. The next one is mouthwashes. Are a concentrated aqueous solution for external use to treat the mouth infection and oral hygiene. Then come to my next slide. What is nasal drop? Nasal drop are also liquid preparation which containing medicaments that are instilled into the nose with the help of dropper to use the treatment of nose infection and blockage of nose. That is generally faced by the everyone in the season of cold or winter weather. Then next one is paints. What is paints? Paints are also liquid preparation way for external application to the skin or mucous membrane with soft brush. Then next one is what is solution. Solution are a clear liquid preparation which contain with or without medicament which is used to internal or external preparation. The next one is syrup. What is syrup? Syrup is also a sweet, viscous, concentrated liquid preparation which containing with or without sugar and medicaments. Then come to my next slides. Semi-solid doses form. If first example is ointment, then what is ointment? Ointment are a solid dosage form for external use which containing with or without medicament with suitable ointment thicky or fatty base. The next one is cream. Cream is also a solid dosage form for external use containing with or without medicament with suitable fatty base. The next one is what is paste. Paste are also solid dosage form for external use containing high proportion of finely powdered medicament with suitable fatty base is known as the paste. The next one is what is gels. Gels are also transparent semi-solid dosage form for external use which containing hydrophilic or hydrophobic base with gelling agent. Then next one is what is poultices. Poultices are also a semi-solid dosage form for external use which containing medicament applied to the skin. Then next one is last one is also gaseous dosage form. There are various types of examples are given there. First one is what is aerosol. Aerosol are a suspension of fine solid or liquid particles with gas, which is used to apply drug to respiratory tract, having atomizer within a device is known as the aerosols. And next one is inhalation, which is mostly used by the people. Inhalation is a internal liquid preparation which containing medicaments which dissolve in suitable solvent or if insoluble suspended in the propellant is known as the inhalation. Then next and our last example of gaseous dosage form is spray. Spray are also a gaseous preparation of drugs containing alcohol applied to the mucous membrane of nose or throat with the atomizer or nebulizer. Friends, then we are discussing about the various type of dosage form. which are generally found in the form of solid, liquid, semi-solid, and gaseous dosage form. Thank you so much